Mixed Mullerian tumor, MMT, also called carcinosarcoma, is a rare cancer that contains both gland-like carcinoma and muscle-like sarcoma cells. It most often appears in the uterus, but can grow in the ovaries, fallopian tubes, or other pelvic organs. Think of it like a hybrid plant that has both flower and leaf features. The tumor shows two different tissue types in one growth. The exact cause of MMT is not fully known, but several risk factors increase the chance of developing it. Older age, usually after 60. A history of estrogen-related conditions, like endometriosis. Previous radiation therapy. Exposure to certain chemicals, such as smoking. Imagine a garden where weeds grow faster when the soil is already disturbed. Similar past injuries or hormonal changes can disturb the cells, making a mixed tumor more likely. Common signs are abnormal uterine bleeding, heavy spotting or post-menopausal bleeding, pelvic pain or pressure, and a feeling of fullness in the lower abdomen. Some women notice a lump that can be felt during a pelvic exam, similar to feeling a small bump under the skin of a wrist. Because these symptoms overlap with many benign conditions, they often prompt a doctor's visit for further checks. Doctors usually start with a pelvic exam, followed by imaging tests like ultrasound or MRI to see the tumor's size and location. A tissue sample is taken through a biopsy or during surgery, and a pathologist looks under a microscope to confirm the mixed carcinoma-sarcoma pattern. Treatment typically involves surgery to remove the tumor, often combined with chemotherapy, drugs that attack fast-growing cells, and sometimes radiation. Think of it as a three-step plan: cut out the weed, spray chemicals to kill any hidden roots, and shine a light to prevent regrowth. There is no guaranteed way to prevent MMT, but lowering known risk factors helps. Maintaining a healthy weight, quitting smoking, and managing estrogen-related conditions, like using hormone therapy only when needed, can reduce overall cancer risk. Regular gynecologic checkups act like routine garden inspections. They help spot unusual growths early when they are easier to treat. Recent research focuses on the genetic makeup of MMT. Scientists have found mutations in genes such as TP53 and KRAS that drive the tumor's mixed nature. New targeted drugs that block these pathways are being tested in early clinical trials, offering hope for treatments that are more precise than traditional chemotherapy. Imagine using a specific weed killer that only affects the invasive plant's roots while leaving the garden healthy. These targeted therapies